Welcome back to Voices in Health and Wellness. This is where we bring together practitioners, healers, and health leaders who are rethinking how care is delivered and received. Today, I'm honoured to be joined by Dr. Irazabal de Sanchez, a licensed clinical social worker, doctor of social work, certified perinatal mental health professional. Dr. Anna is also the founder of YAI Wellness, where she's pioneering culturally grounded healing practices that integrate both with traditional wisdom and clinical knowledge. Her work sits at the powerful intersection of mental health, perinatal care, and decolonial healing. Got it right that time. Anna, welcome to the show. Thank you so much for joining us.
Thank you so much for having me, Dr. Andrew. It's a pleasure to be here.
So maybe we could start a little bit with your story. What drew you into mental health and the healing work that you do?
Absolutely. It's what drew me into this space really just was my upbringing and my immigration story. I was born and raised in Caracas, Venezuela, and then at a young age moved to the United States, and very quickly was exposed to having to cultivate and navigate a dual cultural context, and having to hold very distinct values, one from like my home country and that my parents were still, very much wanting to share with me within our household. And that didn't necessarily look the same all the time with what I was experiencing at school and in the States. So to put a name to it, Venezuela is very much a collectivistic society with very collectivistic value system. The States is known to be more of an individualistic society with individualistic value system. So naturally the clash that comes with that, and being having a young mind and a young teenager having to navigate that duality was complex, and it really just drew my interest in just understanding human behavior more, and the complexities within human behavior. And so I've always been interested in psychology, and that just my immigration story and my upbringing really just drove that interest forward.
Thank you. I always find it inspiring to hear about how people found their path, and thank you very much for giving us that background. Perhaps you could tell us a little bit about your work at YAI Wellness and how it came to be and what makes it unique.
Yeah, I focus on working with individuals that are within the family expansion period of their life. And what that means is starting from just thinking about expanding family, to working towards conception, and everything that comes with that. So loss, fertility challenges, unexplained fertility, pregnancy, postpartum, and beyond. I really got into that work because, again, just my own story of becoming a parent, and understanding just the depth of that transformation and that season in someone's life, and also the gaps in care and support that new parents or expecting parents receive during that period of transition. And so I'm very privileged to be able to support individuals in such a transformational period of their life. And that naturally brings a lot of strong emotions. And I think that I do believe that my approach is unique in the ways that I create space to be able to bring in unique aspects of the individual's identity and cultural background and belief systems, in ways that are not necessarily traditionally seen in psychotherapeutic practices, at least here in the States. And so that's the decolonial lens that I bring in, and the importance of being able to really work not only in the mind level, so like cognition and what's happening in the mind, or even just like biology, which is very important, but also bring in aspects of spirituality and health practices that are maybe outside of traditional medicine. That's important for the individual's life. So I hope that answers your question.
No, it does. Thank you. It sounds like a very unique approach. Is anybody doing this work apart from yourself?
Thankfully, Yes, I am not the only one doing this, and it's been really, really wonderful being able to connect with other practitioners that recognize the importance of approaching mental wellness through a holistic lens and being able to bring all aspects of a human. And the ways that I categorize it is really just working with mind, body, heart, and spirit of an individual, and not isolating any one component of that. Right? It's really just the integration of all those four very important pieces. And we could use more. So yes, there's other people doing this work, and I'm excited just to be able to build that community and spread the word of the benefit of that. And hopefully we can get more people on board.
Amazing. I'm all for holistic practices. I'm very much engrossed in functional medicine, and that's as holistic as I can make it. But it's good to hear that other people are doing taking holistic approaches in their various niches. So what does a typical day look like for you across clinical practice, teaching, and leading YAI Wellness? And I accept that every day is going to be different, but I'm just trying to get some sense of how you spend your time.
Yeah, I think a big part of my identity that informs the way that my day is structured is the morning routine with my two girls. I have two girls, ages 3 and 4. And that really just like sets the tone for the rest of my day. I'm in charge of the morning routine, getting them ready for daycare, taking them off to their school, and then returning and being able to hold clinical sessions. I do one-on-one sessions. I also hold groups. And then the evenings are usually filled with my teaching responsibilities. And I love teaching. And then the afternoon is back again to that mommy duties with my two girls. So that would be just like the average general flow of my day to day.
Thank you. So you're working very closely with perinatal clients and younger adults. And what are you noticing in terms of how they're approaching their care differently from perhaps previous generations?
Yeah, I think something that I am noticing a lot recently is just the intensity of the pressure that young adults, individuals trying to expand their family, or even just like early parenting individuals have. And just the heightened level of pressure, stress, anxiety. We're also seeing the numbers of individuals experiencing postpartum depression or other mental health disorders rise. And I say individuals because postpartum depression, anxiety, and other mental health disorders is not only for women or birthing parent. There is more conversation around just the impact of this just significant transition in someone's life for the non-birthing parents and fathers, and how it's not talked about enough yet. However, we do see also anxiety rise in this season, and the need to be able to incorporate support systems, therapy included. I am hopeful that I do see more men seek support now, so that's really wonderful. And again, there's still a lot more work to be done in that area to destigmatize, right, mental health services, for example, for men, or work against just the historical notion that like men need to have it together, right, in the season, and they need to hold down the fort, and they cannot, experience anxiety in such a transformational period in anyone's life. So I'm seeing a shift to the awareness of working not only with mom or the birthing parent, but really seeing it from a family lens perspective, and really incorporating the non-birthing parent more into the work, and also just support for that. And the added pressures that I think comes from the season that we're living, the reality that we're living right now of too much information, social media outlets, Reddit, Facebook, all of these different platforms that depict the perfect parent, or just to also put names to these, and like the bounce back culture that we live in, right? This false idea of like you give birth and then the next day you are back wearing the jeans before you got pregnant, and you're back at work, killing it and being amazing, and your house is spotless, which is it's a myth. But being able, parents have access to, influencers now, or all of these, accounts that, like, it's much easier to fall into that comparison stage of like, why don't I have it together when they have it together, without knowing that it's a myth to have it together right away.
Thank you. And how are they responding to your use of culturally rooted or decolonial approaches in therapy? You mentioned that. I mentioned that in the introduction. I'm just trying to get some understanding of how they respond to it.
I get a very, very positive response. Part of the decolonial work is really debunking these myths. So really taking the work, looking at things from a macro perspective, right? Putting a name to the systems that are at play that impact then that individual's or that family system's well-being in life, right? So, for example, naming the bounce back culture that we are living in, and therefore really removing the blame on the individual of like, you don't have it together, to, hey, I recognize the expectation. These are the messages that you're receiving from society. It does have a name, the toxic bounce back culture that we're living in. And the reality is that it takes time. Most people, if not anyone that I've come across, recognize that there is a healing period after giving birth, for example, for the birthing parent, and that your, organs don't go back to place right away after giving birth, that actually requires time. And therefore your body is going to evolve and shift, and that is okay. And can we name that as beautiful as well, right? Instead of putting the pressure of losing weight, for example, right away. So they tend to, the feedback that I get is very positive in really being able to alleviate those sensations and feelings of guilt and shame and blame and self-blame, and understanding that where that pressure is coming from, and being able to put a name to that, right? Like naming at a macro level, like the systems that are impacting just this season of transition for them.
Thank you. So we talked about this shift in expectations in younger folks, or do you think it's a broader transformation in the field in general?
What do you mean by that, Dr. Andrew?
So you're talking about you work more with younger patients, and I just wondered whether the expectations that you're seeing with those younger people is perhaps a little bit more widespread, and we're seeing these kind of things in the wider age range of people approaching for therapy.
Yeah, I do think that there is a generational shift. I do believe that younger generations are more open to therapy, for example. Therapy has been less stigmatized for them, and therefore willing to even just like seek help, access help, than maybe their parents did. So I do think that there's that component at play here.
Thank you. I'm digging into the weeds a bit. So we've mentioned decolonial therapy a few times. I'm just trying to dig into the weeds for those people that might not know very much about it. I mean, how do you define it? I mean, you've given us a couple of examples, but how do you define what it actually is?
That's a great question. The way that I would define decolonial therapeutic approach would be in being able to incorporate, well, first, the understanding of history in the work, right? The importance of understanding history and incorporating history into the work that you're doing. And what I mean by that is, for example, if I'm working with an immigrant or a first generation individual in the United States, being able to understand their immigration story, maybe the history of the country of origin for them, and the components that factored in to having to migrate or choosing to migrate, So I think history is very, very important. Understanding the history of mental, the progression of mental health too. So being able to recognize that traditional mental health practices has really been rooted in supporting men. For example, we know more about men's health than women's health. So being able to be very critical in understanding the tools that you bring in to the space with an individual, the place where those tools were meant to work and function and be designed for, and is it a good fit for that individual or not. So I think decolonial practices is really just being able to take a wider look, a bigger picture. So again, looking at the macro systems that are at play that have influenced therapeutic practice, evidence-based practices, and thinking critically of the individual that's sitting in front of you and their history, and is it a good fit or not? Or does these practices need to be modified some bit, right? Or what are the factors that we need to consider? For example, a postpartum individual, talking about the bounce back culture that exists, right? The pressure of having it all together right away that exists. And so if there's one sentence that I would use to define decolonial practices, is really being very, very aware of history and how history plays a role here, and intentional in what you bring into the healing space and the therapeutic space with the individual based on their story and their history.
Thank you.
Mm-hmm.
I guess there's a balance to be had. The sort of clinical standards you're trying to maintain, there's medical science, you're bringing in the ancestral knowledge. How do you balance these things out in the context of the therapy work?
That's a great question. I think I see it more of the art of being able to weave in all of these different components in more of an organic way through conversation. I think a lot of my work is really centered around the decolonial value of radical love, right? And what that means to me, and the way I understand it, is really just being intentional in establishing a very authentic relationship with the person that you're working with. And through that relationship, then it facilitates the ability to be able to weave in these different aspects more organically into the work through conversation and leaning in with curiosity, a lot of questions, and understanding that I'm not the expert of these things for the individual. So creating the space too for the individual to be able to educate me. And I often start the work by telling the people that I work with that they are the experts of their story and they're the experts of their body, right? That I may have more knowledge around maybe emotion regulation and these kind of things, but I need them, in order for it to work, I need them to sit at the table with me, owning their levels of expertise and working with me in collaboration to be able to then facilitate and weave in all these different aspects for them.
Thank you. And with that, have you encountered any resistance, whether that be from your clients or colleagues or the system in general, when trying to introduce this more holistic approach with, the ancestral knowledge?
Yeah. Resistance, I mean, in different ways. Yeah, in different ways. I think that's part of my story too. I worked for many, many years, part of a large hospital system that really gave me amazing training, and I'm so grateful for. And it got to a point where I recognized that I needed to branch out on my own and establish then YAI, right, psychotherapy services, because the ways that I was growing in awareness and wanting to be able to weave in these different aspects, I didn't have the space to do that in the systems that I was operating under before. And so that really motivated me to take the next step and start something on my own. I don't know if I would call it resistance. I think it's just the systems are not designed to incorporate these kind of things, right? And so naturally, it's gonna require a lot of education, I feel, and the time for these systems then to institutions to be able to evolve, right? So I hope that answers your question.
It does. Thank you. Thank you. Mm-hmm. So what's working really well in your practice or your framework right now, whether it's sort of from a clinical side, therapeutic side, business side, what are you most proud of? What's going really well for you?
I think what I'm most proud of and is going very well is being intentional in weaving in a more holistic approach to therapy. The individuals that come to me and seek support really communicate that, like, hey, like we, liked that you named that you're a decolonial worker, because these are aspects that are very important to me, and this is what I'm looking for when it comes to care. I'm seeing now with this like shift with AI, right, and how so many people are using AI for therapy now. I find that individuals are seeking a more authentic connection and a space to fully express themselves in a way that AI can't necessarily offer, right? And going beyond. So at one point, people are very, very much interested in just like, tell me how to fix a problem, right? Like, give me the steps, tell me what to do to get this to change, right? And so what this could look like in the therapeutic space is like, okay, well, engage in this form of breathing for, practice mindfulness in this way 3 times a week, right? Do more movement 20 times a day, 20 minutes a day, these kind of things. But I find that in this season, people are genuinely interested, because they could get that also from AI, right? People are genuinely interested in a very authentic relationship, therapeutic relationship where they could be themselves. And so that I think that being able to provide that for individuals is something that I'm very proud of in the work that I do.
And on the flip side, what's the most frustrating, whether that's, I don't know, a system level barrier or something in the business itself that kind of bothers you, or that you're constantly having to address or overcome?
Well, I think just the hurdles continue to be doing this decolonial work while still abiding by institutional standards. For example, like documentation, right? I do take on insurance, and insurance requires you to do documentation a certain way. So being able to meet the standards of documentation, but in a way that empowers the client, that's a skill in itself, and takes a lot of time to do and cultivate. And so I think that continues to be, and why so many practitioners decide not to work with insurance, right? Because it's very hard to do this kind of work and be intentional and bring in all of these different elements and still meet the standards in a way that supports the individual. So I think that's my biggest frustration right now. But again, it's a dance. I'm happy to continue to do that dance as long as I'm able to, in order to provide the support for people that need it most.
Thank you. So that's kind of like an ongoing challenge of having to negotiate and work with insurers. But what's perhaps one of the biggest challenges you've had to overcome so far in your work that you've solved? I'm just curious to know what the problem was and how you solved it.
And how I solved it. I'm laughing because I think what comes up to my mind for me is just my personality. I consider myself more of an introvert, someone behind the scenes, and in order to be able to put my business out there and do the marketing, I've had to be present more, right? Like be involved in social media, be involved more in ways that are outside of my preference. And the way that I've been able to overcome that is just like focus on just doing it, right? I think about just like the big picture. Like I may not enjoy having to continue to maintain social media presence, for example. And I know that that is a necessary, thing that I need to do in order to reach the individuals and work with the individuals and have the opportunities that I want. So I stay focused on the big picture in those moments that are more uncomfortable for me.
Thank you. And if you had a magic wand and you could fix one thing tomorrow in the business, what would that be?
Ooh, one thing. I think it's okay. That's a very good question. If I could fix one thing, are you talking about my personal business or the mental health field?
Anything really, or the thing that bothers you the most that you would love to have that magic wand to solve, whatever that thing might be.
I think what comes to mind right now for me would be being able to give society the tools that are needed to engage in more authentic conversations that require feeling more, right? Because I've found that our society, we don't do a good job at feeling or wanting to feel. We tend to avoid challenging conversations that are important because they may be uncomfortable. And so I would love just to be able to shift that narrative of one that's like, we don't want to feel these uncomfortable things. And so we're not going to face these challenging conversations, to one of like, hey, these uncomfortable feelings are part of the full breadth of human emotion. They're okay. Let's lean in more and let's, have more genuine, authentic conversations, even if we have these strong feelings around them. I would love
Is that within a therapeutic context, or are you referring more generally to society having these conversations?
Yeah. Well, in the therapy field, because that's a lot of the work that I do, is building comfort with uncomfortable feelings. But yes, if I had the magic wand, I would do it at a global level, honestly.
Amazing. And if you had a sudden influx of 20 new clients next week, what would happen? Would anything break, or would you be able to absorb that level of interest?
No, I don't think anything would break. I would seize that opportunity and problem solve and do what's needed to be able to sustain that, right? I'm very passionate with the work that I do, and if people need support, I'll figure out a way to be able to provide that support, even if that means like working collectively, right? Bring in additional resources or even help them support themselves in some way until we're able to meet everyone's needs in the ways that they want. So I would welcome that.
And you've been in this space for a while now, but if you were building YAI Wellness again from scratch, would you do anything differently?
I probably would have started it sooner. I think that would be the difference that I would pick. If I would do anything differently, I probably would have jumped into it sooner.
I mean, hindsight's a wonderful thing. I get it. So what's next for you? What are you hoping to do over the next 6 to 12 months in the business? Is there any plans afoot?
Yeah, I am currently working on a book right now to be able to reach more individuals. The book is geared towards being able to support individuals in the perinatal period of their life and introduce this lens, this perspective, this anti-colonial perspective on how do you navigate this season of massive transformation in a way that allows you to thrive, right? Because it is hard, and oftentimes people get stuck in this narrative that like once you have kids, your life is over, and people are choosing not to have kids now because it's so hard, right? We're seeing the stats of people, choosing not to have kids skyrocket. So I think that's an indicator of yes, this season is hard and it's in need of a lot of support, and it is possible to be able to thrive in it. But it requires support and intentionality and awareness of these these systems that are at play, be able to name them so you don't place the blame on yourself when you encounter challenges. So that's kind of like where I'm focused. And the work is going to be for the next like 6 to 12 months, being able to complete that.
Wonderful. Do let us know when you have a title, and we'll put it on the bio page for your podcast episode so people can
absolutely
go and buy it. And on that note, Anna, I'd like to thank you so much for your time this afternoon, talking to us about your work and giving us some deeper insights into this particular strategy of approach that you have. It's been really interesting and informative. I'm really grateful. So thank you so much.
Yeah, thank you so much for having me. It's wonderful to have this conversation with you. Thank you.